Thank you. You mentioned the little ones. Let's talk about the little ones because I saw this headline earlier about measles. Why are we talking about the measles? Let's ask this guy, Dr. Mike. Dr. Mike.
Yeah, I'm seeing another side of you. I'm always on that side. Now I'm on this side. Oh, whoa.
This is my better side.
You look fabulous on both sides.
Yeah.
Anyway.
Okay, so there's 22 million infants worldwide missing vaccinations for, I guess, for what reason?
Well, COVID. And it's really important to get your kids vaccinated. We all talk about COVID, but the bottom line is that there's so many other vaccines out there that you can't get behind on, along with things like your colonoscopies and everything else for all of us. Don't forget to get your routine medical care. It's well documented. COVID has had negative effects.
Yeah, so many people during COVID put off doctor's appointments and all that. I heard that trying to get an appointment with a gastroenterologist or any specialist can take months.
Well, I feel kind of like a stockbroker.
Yeah.
I'm calling, I'm promising. Do you know how many bathrooms I've had to clean to get my patients in to do stuff? It's incredible. I by whatever means necessary. That's what it takes.
Okay.
That's whatever it takes.
Speaking of COVID, every day we have a new report, and the one out this morning says COVID cases, infections are rising again in 22 of the 50 states.
Right. A couple of issues at play here. Number one, perhaps immunity is going down. That's why a lot of people are saying everyone over 18 you should get a booster if it's been 6 months or so after your. So that's one thing. Cold weather, getting together, and absolutely people who have not been immunized at all get vaccinated.
Okay.
But it could be a sign that with the winter and the holidays, we could be seeing more and more cases.
Yeah, you're concerned about that with winter here, people staying inside, and then you get together for Thanksgiving and Christmas.
You better believe
everybody's close together and
yes,
all that.
hugging.
Would you let an unvaccinated person come over for Thanksgiving dinner?
I would, but I would be very careful and be clear that they perhaps need to wear a mask. It really depends on whether there's high-risk individuals in the house.
Yeah.
If grandma has a problem, you need to make sure of that.
Hey, a very healthy Minnesota Vikings football player was hospitalized. Had to rush him to the ER because of COVID complications. Why would it come on so fast like that?
Well, from what I have read and understand, he was found out to be positive a week ago.
Yeah.
Now, this virus, even if you are fully vaccinated, it doesn't mean that the vaccine doesn't work, but nothing's 100%.
Right.
Now, it could be that he needed a booster. Perhaps he has underlying medical conditions, but you can still get sick. Now, hopefully, that he will be just fine. He was hospitalized. Maybe he got monoclonal antibodies. He's getting more intensive treatment. Maybe he has mild asthma. Who knows?
Okay.
But the bottom line is it's not a failure of the vaccine. He probably would be on a ventilator or on death's doorstep had he not been vaccinated.
That's the most important thing there.
Done.
So these little home COVID tests,
yeah,
that's kind of a cool deal. I can just run over here to the drugstore and get it. But now this one brand is being recalled. Why would they? Is it called Illum or Illume? Do you know?
I don't know. I like Illume.
I do too.
But I think it might be Illum, like illuminate.
I got
bottom line is that, look, these home tests are very useful. If they are positive, you need to call one of us. And then what I do in my practice, I usually confirm it with a PCR test. That's a molecular test that, these antigen tests are good, and it has to do with something called sensitivity and specificity. They're not 100%.
No.
So the problem with this, and the reason the FDA is recalling this ×2 now, is the fact that they can be falsely positive, which can cause problems.
Let's say I take it and it comes back negative. I can believe that?
Well, it depends on whether you have symptoms or not. If you don't have symptoms and your test is negative, I'm okay with that.
Yeah.
But if you have a positive test, then that needs further evaluation with a PCR test, in my opinion.
I'm not going to rely on that.
Well,
I'm going to go to an expert, a real person.
Well, I'm good. I haven't swabbed you, have I? I've swabbed a lot of people. I'm good.
No,
I'm very genteel.
I don't think you would call that swabbing.
Well. That was a different kind of test, Michael.
Yeah.
Yes. I'm genteel there, too.
Oh, yeah. But every time I'm near, he wants to swab. Hey, coming up, good to see you. Have a good weekend.
Love you.
Say hello to the family, please.
I love you.